When Dr. Crenshaw talks about intersectionality and the ways that we understand it, it's so multifaceted, so multi-layered, and I don't think we ever will understand everything that goes into being an intersectional human, if that's even a thing, right? But you have all of these different dynamics that make you who you are, and so for some people, being Black is their top intersectionality or their top identity, and for some, being part of an LGBTQ plus community is part of their top reasons for, for their identity. And so being a mother, being a white woman, all those things can exist and be fine. So finding someone that can meet that need in this very complex society where mental health care is so very siloed is impossible. So the only way we can address the work in the ways that we want to, with integrity, with honesty, with true deliverables, is to create space for those same people in those communities to be part of this work. So Dignity Health Collective is opening our hearts and the work to those who truly want to heal within the communities that they most identify. And it doesn't matter to us what that is. It's more about how can we create the space for you to feel good, for us to teach you well to go into this work and do it. And so understanding who you are is number one, right? Because again, if you have a bunch of things that make you who you are, it's very difficult to figure out where you're leaning on any given day. But part of the work is understanding you, right? A little bit more. So okay, yeah, this is something I hold to be true for myself. So this is the space in which I want to do my work. I think for humans overall, we just are really confused about life and who we are and where we want to go and what we want to do. And we know that the same is true for mental health, right? Yeah. And for care and how we care for people. But if we can create this system where we're saying, bring you here, we'll help you right away figure out a little bit more about who you are and where you lean in terms of your identity and what you hold true. And then we create curriculum and space for you to learn how to show up for that particular part of you well. And I don't think anyone else is doing that because it's not a field that typically allows that, right? Yeah. It's very curriculum driven. It's very textbook driven. It's very data and research driven. And we are truly leaning into identity and heart and who you are as a person and what healing looks like for the communities that you want to work in. So I just think the model in and of itself is so different than what we've seen, which is, to Julie's point, we've seen it done, but it keeps happening the same way. So we're not really getting anywhere.
And I think it goes back to, we're not defining health for anybody.
Nope.
We're gonna help you define what health means to you. Because I think that's where we've gone wrong in many of our attempts, our society's attempts to provide better, more authentic, more caring healthcare is trying to figure out what that looks like. And it doesn't look the same for any one person or any one community. And so much of what this model is about is we want to learn from you, we want to hear from you what healing and health looks like for you. And then, as Candi said, then we'll help support you being able to carry that and heal more people, whether it's within your community or others.